Kia ora, it's Isis here again from Women's Health Action, and today I am joined by lactation consultant Karen Palmer to chat about breastfeeding and in particular what to expect when accessing support services during the COVID-19 pandemic and also breastfeeding in general. So welcome Karen, and maybe you could start off by telling us a bit about yourself.
Kia ora, Isis, thank you. So my name is Karen Palmer. I'm a midwife, and before that I was a neonatal nurse, and I've been a lactation consultant for about 25 years. So a bit of a dinosaur in this field, really.
Also a really great knowledgeable person to be talking to, so that's awesome.
Maybe, yeah. And I currently work for Eastern Bay of Plenty Iwi Alliance in Plunkett, doing a community-based breastfeeding program which involves lactation consultants in Kaiawhina working in the community. And our service is called Whakamanahea Te Awaiu, and it's nearly 1 year underway and it's going really well. I am the mother of 4 grown children, all breastfed, and 5 mokos so far, all breastfed long term, including a set of toddler twins.
Oh wow, you must be a busy granny.
Yeah, busy granny. And so breastfeeding's certainly been a big part of my world. It was a big part of my midwifery practice too. And with that goes not only successful breastfeeding, and the woman defines her success, but also confident parenting, confident mothering. That's all part of the package. So that's what I'm about, really. Yeah.
Right. Now I understand you also developed a pretty cool app called Breastfed NZ. Do you want to tell us a little bit about that? Because I think it's probably something that might be quite useful for people at the moment.
Yeah, it's when I was working in the Bay of Plenty DHB about 4 years ago. It was a Midland Project, Midland DHBs, looking at different ways to get support and information out to women, very much working out that if it isn't on the phone, it doesn't exist. So developed this app, and I was the main content developer. I've just got a poster of it here, so that's it there.
Right.
And
you can just find that on the App Store?
Yeah, on the App Store. It's a free download. It's on a bit of a dated platform now, I have to say. But so you do have to do a little bit of a search around, but it covers everything from pregnancy to weaning and everything in between.
Right.
Using it quite a bit at the moment in this COVID time to give people snapshots of information and pictures and sound bites of what they need just here and now. Yeah, so it's going well. It's probably used by a good percentage of mothers in New Zealand. And at this time we have to be very creative about what we do.
As you know, we've been conducting a survey, and we found out that understandably many people are feeling anxious about breastfeeding during this time. And of the 460 plus people that we have surveyed, over 50% of the respondents are currently breastfeeding. Over 30% are planning to breastfeed when their baby's born, and over 50% of respondents have reported not having enough or any information about breastfeeding and COVID-19.
Yeah.
And interestingly, most respondents reported that COVID-19 hasn't changed their intention to breastfeed, although a small percentage say that they're less likely to wean during this time for immunity reasons, and a few have reported that they would stop breastfeeding if they tested positive for COVID-19. Like, I know the Ministry of Health and the New Zealand College of Midwives had plenty of information about the importance of breastfeeding, specifically during COVID-19, on their websites, and some of that we've covered in a separate video. But I thought it was probably great to have a chat with you about some of the specific questions and concerns that people had about establishing and continuing breastfeeding during this time, and how to get help if they need it. So yeah, and I thought maybe if you could start off with telling us a bit about the New Zealand Lactation Consultants Association and what lactation consultants usually do in sort of business as normal and how this has changed during COVID-19.
Okay, so there's about 250 lactation consultants in New Zealand. Not all those are employed in the role. Many are midwives or nurses or some other allied health, and many have come up through the consumer stream via La Lactation League or some other consumer stream like that. So the role of a lactation consultant is to help support breastfeeding, protect, promote, support breastfeeding. And I guess in New Zealand, the majority of the lactation consultants are involved with problematic breastfeeding, whereas overseas in the States, where there isn't a strong midwifery culture at all, many lactation consultants are involved in normal breastfeeding. But here in New Zealand, midwives are the mainstay of initiating breastfeeding. So as lactation consultants, we really just come in when there are sort of complex issues that need something over and above what the midwife or consumer support group can offer.
Sure.
Yeah, so the New Zealand Lactation Consultants Association are our professional body, so to speak, and they help ensure that we have good education rolling all the time and help us with guidelines of practice, scope of practice, and all those sorts of things.
Cool. So I understand that, I guess, just like lots of different professions, lactation consultants work in many different settings, and some of them might work in the hospital as a DHB employee, some of them might work in the community, such as yourself, and some of them have private practices. Does accessing an LC, if we call it that, does it cost? I guess that's variable as well.
Okay, so let's start in hospitals. So because every maternity unit in New Zealand is BFHI, Baby Friendly Hospital Initiative accredited, every hospital that is secondary or tertiary care, in other words, a hospital that offers epidural, caesarean sections, etc., all employ lactation consultants.
Okay.
And they're on every maternity ward, and just to let you know that they are working as normal. They are still available to women giving birth. Things might look a little bit different about how they function, but very much they're aware of how they need to meet the need at the moment. Right. And when it comes to birthing, I think one of the biggest challenges for women right now is not being able to have a partner stay or have limited visitors, limited support networks. So very much the maternity staff and the lactation consultants are aware of that and are trying to really help women to sort of get underway so that when we go home, they've taken that first step.
Oh, that's great to know that they're still there on the ward.
Yes, they are, very much so. And they've had extra training around how to manage any COVID-19 patients or women who've been exposed. But very much it's business as usual. And what we really want to reiterate to women is, amongst all the scary and different part about birthing, that, excuse me, I've got my doll, that skin to skin, straight after birth, and that early feed is business as usual. It doesn't change at all. So babies do not need to know about a 2-metre rule at all. Also important to know that skin to skin and that early feed helps protect a baby from any bugs around. So it's very important there isn't a separation between mother and baby at this time, unless it's for very strong medical reasons. So there's no interruption to that practice at all.
Right. So if you wanted to, say for instance, if you've given birth at home or after you've come home, is face-to-face appointments still available with lactation consultants at the moment, or will that be something that's happens over the phone, or is there a bit of triaging going on?
Yes, well, as soon as level 4 was announced, we all sort of got our thinking caps on, really, because no, we can't do face-to-face visits. We are mostly deemed an essential service, but we have to be creative how we do this. So really, once a woman goes home or she births at home, the midwife is probably the only health professional who's doing any face-to-face visits.
Sure.
So we've rallied around very quickly and created different ways of doing this work, and it's been a challenge for especially people my generation that are not that IT savvy, but of course our clients are very much IT savvy. So most hospital community or DHB community services have set up Zoom, Skype, phone, video, a whole lot of options really to support someone. And so business as usual for most breastfeeding services. So if women are wondering, they can just look on the front of their Well Child book and start with the number that's there.
Okay.
Yep, and of course there are a number of lactation consultants who work for Plunket doing the 24/7 LC support via Plunket. That's functioning as normal too.
Over the phone or online?
Yeah, on the phone,
Yeah.
online, Zoom.
Yeah.
And a group of us have also set up a volunteer page called Lactation Lockdown to provide LC support for those women who can't access anything for one reason or another. And we're just volunteering our time or video talking in or sending screenshots of something from the talk cards or the app and just having a conversation or a video link. And I think to date we've helped 30 to 40 women in the last week or more.
Oh, wow.
And they've mostly been young babies in the establishment phase of getting underway. A lot of this too was to help out our midwifery colleagues because we know that they're under the pump at the moment. So if we can all help each other, then that's a good thing.
Right. So that's Lactation Lockdown on Facebook.
Yes.
So we'll cut to that. So now I've got some really specific questions for you. Hopefully none of them are too curly. People wanted to know about when to seek help for nipple pain, blocked ducts, mastitis, and how you might be able to avoid stuff like that in the first place.
Okay, yep, very good question. And this is our bread and butter really, Iris. And I'm just going to get another prop as my knitted breast. So for those women out there who are about to have their baby, if there's one thing I can suggest is that they learn how to gently massage and hand express a little bit of colostrum.
You might need to just bring your camera down there because we can't see that. There we go, that's great.
Is that good? Yes. Yeah, so I think women who are pregnant, they just learn a bit more about their breasts, how to massage gently, how to get a little bit of colostrum out so that when their baby gets here, they're one step ahead. And in the early days of their milk coming in and sore nipples and things, if they know how to move on lumps and bumps or to soften a nipple before a feed, that just goes such a long way. It's something very, very simple, but 2 hands on your breast can just help enormously. So that's the first thing I'd like to say is take care of the basics. You don't need expensive equipment or anything, but if you know how to get your baby to feed and you know how to manage your breasts, then you're well on your way.
That's great. Now, I just wanted to check something with you. I know that not every pregnant person might be able to get colostrum before their baby's born. That's not an issue. That's not indicative of your milk supplies. But it's just something some people have, some people don't.
Has nothing to do with it. And you might only get a glisten or you might get several teaspoons. It doesn't matter. What really matters is you know your own breasts really well and you know how to work them.
Yeah, that makes
how
sense.
They fit, how they feel with your hands, and how you move them around, your own shape, your own size. It's just so important. Yeah.
So sort of on the back of that, I guess actually you can continue talking. Obviously we haven't covered off mastitis yet.
It's the same with mastitis. Most early mastitis occurs because there's broken skin on the nipple and then there's lumpy bits of milk left behind and infection will track up. So again, if women know how to just get rid of lumps and bumps at the end of the feed and they know about basic nipple care, then that will help keep them out of trouble. And of course, with all the extra hand washing we're doing right now, and that's something I forgot to say, is any bit of advice at the moment is extra hand washing before touching the breast or feeding baby
Sure.
And also on the app, there's some really good information about nipple pain, managing sore nipples, blocked ducts, mastitis, all those basics are there. So I think if someone can tap into something or someone that can help them with their basics, of course the midwife will do a huge amount of this in the early weeks, remotely or face to face, and but it's those basics that help things go.
Okay. And they'll be able to let you know if you're getting a breast infection that requires more attention. I understand that midwives can prescribe when they're still looking after you if you need antibiotics and stuff like that.
Absolutely, and it might be a matter of, you know, on your phone, you check in with your midwife, you send her a picture or something of how your breast looks, and the midwife will give the basic information, and if the woman's got a fever, not getting better, can fax a script to the nearest pharmacy.
Right. Okay.
Yeah. After 6 weeks, it'll be about accessing GP care for that.
Sure. Yeah. Thank you. That's really good. Now talking about supply, I know that that's an issue that people are often really worried about, and especially people are thinking about how their supply might be impacted if they do get sick, if they get a fever, or if they just be stressed. And it'd be good to sort of get some ideas around supply and, you know, the basics or maybe on how that works, but also when to understand if that is an issue and when it's not.
Okay. So very good questions. It tends to be more of an issue with the first baby than second or subsequent. Some women having the first baby may have a slight delay with their milk coming in, some don't. I think it very much depends on how the birth went, how things are going. But this is where if someone hasn't had an easy birth, if they can stay a couple of days in hospital to get that help and support underway, that'll be great. And of course the midwife will be doing a face-to-face visit and checking baby within 24 hours of discharge, and then again between day 5 to 7. Now that first weight of the baby tells us a lot about mama's milk supply. So if there are issues, they can often be identified then and something put in place. And when it comes to milk supply, it's a bit of the hare and the tortoise story, if anyone knows that story. Some people come to milk with a hiss and a roar and off they go, and others plod in slowly. But both might be at the same place by 6 weeks. And we do know it takes 6 weeks to establish your milk supply.
Okay, that's good.
Yeah. So, and what comes in must come out. So it's about knowing that the baby is having more and more wee, more and more poo as each day goes on, and that the nappies are getting heavier and the baby's getting heavier, but also that they seem satisfied after a feed.
And if you were concerned to get, I guess again, you'd be wanting to talk to your midwife first off to check that's something that's tracking along nicely.
Yes.
And, we'll have to talk to our midwifery partners about this, but I'm imagining that they've got ways of making sure that baby's getting way appropriately those things taken care of during that time. So we'll ask that question of a midwife when we get to talk to them.
Yes.
It is something, would your supply be impacted if you do become sick, if you're feverish? Is that something that can happen temporarily?
Oh, absolutely. With or without COVID, if anyone gets unwell, any feeding woman gets unwell and she gets a fever, that will dampen your milk supply for a period of time, because any fever you get a bit dehydrated, and your body is trying to fix you, you know. But the good news is a milk supply will always bounce back to its baseline once the mother is well again.
That's really good.
Any dip in milk supply is not a permanent thing, so it's very important.
Bodies are very clever, aren't they?
Yeah, they're very clever, and it will bounce back. Yeah.
Sure.
But yeah, if anyone gets unwell, COVID or not, any flu, any fever, mastitis, there will be a slight interference for 2 or 3 days.
Sure. And I guess on the back of that, I know that people, when they are worried about their supply, might look to reach for certain lactagogues, or like different cookies or things that can increase your milk supply, teas, etc. And there's also some medications that I'm aware of, that domperidone, for instance, that someone might be prescribed. I've never been sure about the old lactagogues and stuff. I had drunk a lot of breastfeeding tea myself, and I thought, well, if I guess if nothing else, what I'm doing is drinking more fluid, so that can't be a bad thing. But what's your sort of professional opinion on those things? And is it a case of some things work for some people and some don't for others, or?
Absolutely, and let's come back to the basics. If breastfeeding's going well, if it ain't broke, don't fix it.
Yeah.
So I think it's important that women know they don't have to take this tea or this substance to make milk. And if they haven't identified lowish supply, then some things might be recommended, some galactagogues. But whereas one thing will work with some people, it won't work with something else, someone else. Every culture actually tends to have its favourites for milk. And so if in doubt, ask a granny if you've got a granny. But otherwise, it's I could name a few, but it's a little bit random.
Yep.
And right now access is very limited. The pharmacies will also have a herbal dispensary, so that might be a place that someone can ring up and get what she needs put on the counter for them to pick up.
Okay, and then again, with something like the domperidone and some of those prescription things, that would be something that your midwife, if you were in that period of time, would be able to assist you with, if they thought that was something that was going to be helpful.
Absolutely, midwife or GP, but it needs to be for a recognised problem with feeding.
Sure. Yeah.
So therefore, you've got to try all the basics first. You've got to make sure the feeding is good, that both breasts have been well drained, that other sort of day-to-day measures are all fine first.
Sure. Yeah. Now, while we're on the topic of prescription medicines, people had some questions about where to get good information around breastfeeding while on prescription medicines, and specifically, and not surprisingly at this time, things like anti-anxiety and antidepressant medication, those sorts of things that it's not always clear whether or not they're breastfeeding safe or not. Is there a place that's really good for that information?
Yes, there is. But it's not that consumer friendly, I have to say. So definitely starting with the prescriber. Sure. And ensuring that the prescriber is using a dedicated database for medications and lactation. A LactMed is one. And also local pharmacies at each DHB have all the right information there. So what we want to avoid is someone going to say, the generic drug information sites, which only give the manufacturers advice, sure, and not a dedicated research-based advice.
I think that's where people can get quite confused, because a lot of things say that it's not suitable for breastfeeding or pregnant women, but actually you might find that your midwife who's got all that knowledge, or a lactation consultant, nurse, a GP will prescribe those things, and that's where I think people get a bit confused sometimes.
Yes. Yeah. There's very few things you cannot take while breastfeeding, and those things are when a woman has a known at-risk medical condition.
Sure. Yeah, that makes sense. Yeah. And so while we're on the topic of these sort of curly subjects, we have had, and not surprising to you, I'm sure, we've had quite a bit of questions around tongue tie and how might that be managed during this period of time, and whether or not their baby, people's babies, if they do have an issue, can be assessed and treated if required.
Okay, yeah, that is a curly one right now, I have to say. So hopefully if it's an obvious one that's interfering with the baby even getting onto the breast, that's identified at the place of birth, not so much at home birth, and can be dealt with within a DHB at that time.
Okay, and so like if you're at the hospital.
Yes, yeah, yeah. Because we want to keep everything safe. We don't want people going to appointments once they go home, or that they can stay home. So, and I think any of the lactation consultants attached to maternity units will be able to do that assessment before someone goes home, and then hopefully something can be put in place. And apart from that, if the baby's slightly older, any sort of procedure around a tongue tie right now would be deemed a high risk activity.
Okay.
So it will be a case by case basis.
Sure.
But I think it'd be a matter of trying everything else first.
Trying to have lots of other strategies, working with your midwife or lactation consultants such as yourselves over Zoom or Facebook or whatever, to try and sort of get by until, if needed be, further things can be done. Yeah, that makes sense.
Yes, and it is about being creative at the moment.
Sure. The other questions we had, so this is turning into quite a long interview, so thank you so much for your patience. The other question we had was around information about pumping and storing milk, especially if people are worried about getting sick, and it's something that we tend to do quite often these days, and whether or not there's a good source of information or any advice around extra precautions around pumping and storing milk at this time.
Yeah, any sort of handling of feeding equipment, whether someone's breastfeeding, pumping, or bottle feeding, really extra hand washing and disinfecting of surfaces, etc., is very important. So if a woman is wanting to sort of express off a little bit of milk and tuck it away in the freezer for a rainy day, or milk in the bank, so to speak, that's important to her. What I'd suggest is that she just does one pumping first thing in the morning after she's fed baby, and because that's the time of day when you tend to have a little bit of excess, it doesn't muck things up too much. It's important women don't over express at the moment, or any time actually, when they are establishing that supply demand. And so just once a day, tuck it away, and I would probably suggest no more than 80 to 100 mils over and above your feeding per day. Otherwise, you tend to get into a little bit of trouble.
So it's in a sterilised bag. You can pop it in the freezer, or
yes, pop it in the freezer. There'd be plenty of there's plenty of information around about safe storage of your breast milk. The key is always in the back of the fridge, freezer, wherever, not on doors, and and just be very careful with cleaning and contamination.
Okay.
I think we haven't covered, Isis, about what if someone has COVID or suspected COVID in breastfeeding.
No, we haven't, and I know that there is some information, but it'd be great for you to cover that off if you if you'd like to talk to that.
Very basically, really, it's much safer for a baby to stay with mother, an unwell mother, and stay breastfed, because the mother will make immunity in her breast milk to help protect her baby. But if baby is removed, that protection is gone. So that's why mother and baby stay together and keep feeding. The mother wears the mask, scrupulous hand washing. Now, if the mother's really unwell, it might just be feed and hand to someone else to care for the baby. Or if she's too unwell to feed herself, it might be about help to keep her milk being expressed, keep it turning over, and someone else caring for the baby. But to stop breastfeeding in the middle of illness is actually a risk for the baby, because the baby loses that protection.
Sure, that's really good point, actually. Thank you for that. I don't know whether you're going to be able to answer this question or not, because it does seem to be quite an unknown entity, but what do you know what changes would happen to LC care during alert levels 3 and 2, and how that might be different than now?
A little bit, I think. I'll just put my glasses on. I looked it up. I think when we go to level 3, there'll still be no face-to-face visits, definitely no group visits, but probably the restrictions for midwives will lift a little bit,
Sure.
and perhaps it might be easier for people to get out and access things, or you know, a trip to the pharmacy or something like that. When we go to level 2, again, no groups yet, and probably screened face-to-face contacts from LCs will be okay, but definitely keep finding alternative ways to reach.
Yeah,
And
yeah.
you know, in the last couple of weeks since I've been doing everything electronically, it's actually been quite good.
Yeah.
It hasn't actually been that difficult, and women are really great at sending a short video or something, or a picture or something, and we have a chat. I might screenshot her a bit of information, and I think it's going okay.
Cool. Yeah, it's going to be an interesting time to see how things change after that. I know a midwife I was speaking to, she said she's getting a sense that she's actually talking more to her women, actually having much more comprehensive discussions now and spending more time than pre-COVID. So yeah, it's interesting. So are there any other you know, common sort of questions or concerns that you're hearing during this time that you want to share?
I think it's very hard if someone's just had a baby and they can't have their normal support networks around them. Their mother can't come and visit, you know, or their sister, or their good friend who's breastfed their baby. I think it's probably a lot of pressure on the men if it's their first child to be the only support, and it's new for them too. But I think everyone's been quite creative in finding various ways of gathering that support.
Yeah.
But I know that if it was any of my daughters having a baby right now, they would have found it really hard if I couldn't have been popped in every day, you know, for several hours to sort of help out. So I think women are working really hard at the moment and doing a really good job.
Yeah, and just reaching out, I guess, on places like your Facebook group or other sorts of online groups is probably really...
There's plenty. And it looks like every town has sorted out something to help women. So check your local networks first. Try the first number you come across and just keep going until you can find someone who can help you.
Awesome. Well, thank you so much for chatting with me. I think we've covered off a lot, and I think people really enjoy this video. So thank you so much.
You're very welcome.
Enjoy the rest of your Easter.
Okay. Thanks,
Thank
Isis.
you.